Hello, good evening, welcome everyone, and thank you for joining us tonight for our session on what's new in digital health for private specialist practices. My name is Charles Broadfoot and I'm one of the Professional Development Officers with Hunter New England Central Coast Primary Health Network. I'd like to begin by acknowledging the First Peoples and traditional custodians of all the lands in which we are meeting on tonight and pay my respects to elders past, present and those emerging. Tonight's session is being recorded and the recording and the PowerPoint slides will become available from tomorrow on our website. So to access these, you just head to our homepage, thephn.com.au, and click on the Education tab. There will be a short evaluation survey that will automatically pop up when the webinar ends. If you could just take a minute to fill this out before you log off, we really appreciate any feedback that you can give us. Please type your questions in the questions box in your control panel at any stage tonight throughout the presentation, but please know that we have allocated some time after the main presentations to go through these questions with our speakers. It's now my pleasure to introduce tonight's speakers. Firstly, we have Samar Omar, who is a digital health educator at the Australian Digital Health Agency with over 10 years experience working in the healthcare industry, including roles as a pharmacist manager, locum pharmacist and an aged care pharmacist. She is passionate about implementing the use of digital health technologies across multiple healthcare settings to optimise patient health outcomes. Thanks, Samar, welcome. And also speaking tonight is Peter Mullen. Peter is a digital health officer with Hunter New England Central Coast, PHN. And also joining us there in the background is Jolene Stewart, who is also a digital health officer with the PHN. So thank you again, everyone, for joining us this evening. I'll hand over to you now, Peter, to start your presentation.
Thanks, Charles. Can you see my screen there, Charles?
Yeah, that looks good.
Excellent. All right. Thank you for joining us this evening, everybody, and welcome. What we're going to run through tonight is just obviously talking a little bit about My Health Record for private specialists. And we're going to look at, what are the benefits for using My Health Record, what's in it for your practice and for your patients. We're going to look at the privacy and security requirements for accessing My Health Record.
Oh, you've just gone on to mute there, Peter. Sorry, we can't hear you.
Sorry, can you hear me back now?
Yeah, that's great.
Excellent. I might turn off my webcam though. I'm struggling with bandwidth here at the moment, I think. Sorry, I'll quickly run through that again. So we're going to identify the privacy and security requirements for accessing My Health Record. Describe how e-prescriptions, e-requesting a pathology and receiving e-referrals can also add value to the practice workflows and patient benefits through their access to different healthcare. And also just look at the foundational requirements for using digital healthcare in practice, including PRODA, HBOS, and NASH, PKI certificates, and where you can get some support for those. Charles, has that changed now down the screen?
We're still waiting. Oh, there it is, yeah.
Yep, okay, sorry everybody, I'm really struggling with bandwidth tonight. So look, what we're going to do is obviously look at My Health Record. It's designed to give you better access to a number of things and help you support your patients and caring for your patients. Some of the basic benefits, and I'm not going to go into too much of these because I'll let Samar go into that, but it's improved clinical decision making. It does help avoid duplication of tests, scans and diagnostics, fewer adverse patient events for your patients, and it lowers the administrative burden within the practice. There's a lot of different benefits and organisations that feed into the My Health Record, and a whole lot of, again, different pieces of information that all come together in the My Health Record. But you can see a few of them there: hospitals, obviously specialist practice, general practice feeding into it, allied health pharmacy, and there's a lot of different information that comes up into the practice. One of the ones that we do get regular feedback from specialists is access to the medicines view and things like that, and I'm sure that Samar will cover that as well as part of her presentation. So I might actually hand over to Samar now and let her take over.
That looks good, Tamar.
Okay, cool. Thank you. Thank you again, Peter. So let's get started. Okay. So My Health Record. Now, some of you may engage with your own My Health Record, so you may already have some background, or you may use it in your practice. Some of you may not be too familiar at all, so that's perfectly okay. So hopefully tonight you'll be able to, take something home with you. So in terms of My Health Record, basically we refer to it as an online summary of an individual's key health information. Now, we do stress that it's a summary, it's not a complete record, and it's not designed to replace any existing records or information, but more or less to be used as a complementary source of information. So one of the great features of the system is that it is personally controlled. So it is up to an individual whether or not they would like to have a My Health record, as well as what's in their record and who can access their record. Other key features is that it's part of a national system and it's accessible at all times. So wherever the person is in Australia, they can be traveling interstate, they can be in their home state, but it could be, for example, after hours, their health information will follow them. So it just removes that burden that's often associated with people having to record their medical history, especially when sometimes it can be quite complex. So at the point of care, especially in an emergency situation, again, having access to information in a timely manner can really help support the management of the disease and earlier diagnosis. And of course, given the nature of the information that's held within a person's My Health record, it is strongly protected. So we have legislation that's specific to My Health record that governs the way it's used. We have a cybersecurity center at the agency that also monitors the system 24/7. There are significant penalties that apply for any deliberate misuse of the system as well. So not to discourage anyone from using it, but of course, just to encourage appropriate use of the system. So in terms of how we're tracking with use across the nation, so there's about 23 million Australians that have a My Health record, so that's about 9 in 10. And then in terms of engagement within the healthcare setting, so as you can see, we have over 90% across the pharmacy setting, GPs, as well as public hospitals. We also do have significant engagement with private hospitals, and we are building, slowly building the connections in that specialist space, as well as aged care setting, of course. And the more sort of engagement we have across the different healthcare settings, the more reliable the information, the more information you can find within the record, and the more it can be relied upon by the different members of a person's healthcare team. So what you can see on the screen here is the three main sources of information where information would come from to be held in a person's My Health record. So on the left-hand side, you can see the consumer documents. So as I said, it is personally controlled. So a person can add personal health summaries or personal health notes. They can also add their advanced care planning documents, again, just to highlight their wishes for future medical care. Then we have documents that come through from Medicare, so Medicare services that are claimed, as well as immunization information and information from the Australian Organ Donor Register. And then what you can see on the right-hand side will be the bulk of information that you'll hopefully see, which is provider documents. So I will be touching on these in a little bit of detail, not too much in the coming slides, but I also wanted to focus your attention on the 5 circles that you can see in the middle of the screen there. So these are what I refer to as the My Health record overviews. So these aren't individual documents that are uploaded to the system, but they are overviews that are automatically generated by the system, and they extract information from the documents that are in the system and just consolidate that into an easy view. And I will show you an example of that as well. So first sort of document to share is one of those provider documents, which is the shared health summary. Now, in a lot of cases, this might be the first document that you would access for a person. It's a very good starting point, especially if it's a person you've never seen before. This document is designed to be like a snapshot of a person's health status at a particular point in time. So the key areas that you can see outlined in red there, the adverse reactions, the medications, the medical history, and the immunizations, they're all captured in this document. If anything was to change in those those categories, then that would prompt the need for a new shared health summary to be uploaded. And what you can see at the bottom of that document is the administration section, which is where you can see the details of who authored that document. Again, just to help you follow up and give you an idea of who this person's primary provider is. This particular document won't be uploaded by just any provider. It would be their nominated healthcare provider, which in most cases would be their primary healthcare provider, but it also, for example, could be an oncologist if they tend to see them more than for example, their GP. So essentially the people uploading these documents are a lot limited. So again, just to give you an idea of where to direct that sort of further communication if you need to. Now what we have here is, this is one of the examples of the overviews. So this is the medicines information view. Now what you can see on the left-hand side is all the different documents where you might be able to find medication information. But as Peter mentioned, we're all about trying to reduce the administrative burden. So instead of having to look at all those documents separately, which can take a bit of time, by clicking on that medicines information view, all the information from those documents will be consolidated into that view. And then if I just zoom in a bit, so it's got sort of 4 key areas for you to navigate that view. So the default setting being the allergies. Then we have the next tab there is the medicines preview. So this is where it'll sort the medication for by active ingredient, which is really helpful when it comes to medication reconciliation tasks. And then from this same view, you're also able to access the most recent shared health summary. So again, more than one way for you to access that versatile document that we just saw. So just to focus a bit on the allergies, which I can imagine will be of quite significance to you in your practice. One of the first things you want to sort of be alerted of before you start providing care to that particular patient. So again, at the bottom of this, you're able to see where the allergy information has been extracted from. So in this particular case, there's some allergy information that's come out of an event summary, but then there's also allergy information that's come from a patient entered bit of information as well. So here, the immunization consolidated view, another one of those overviews, one of the recent enhancements that was done earlier in the year to support the COVID-19 vaccination rollout. So this overview, again, really similar to that medicines view in that there's 4 key areas to help you navigate your way through the top there. So you're able to source immunization information from the Australian Immunization Register, but as well as any other documents from the record that might not be on the Australian Immunisation Register, as it wasn't always mandatory to report to the register. And in this screen, you're also able to view the person's immunisation status. So we're all familiar with the discharge summary. So again, just wanted to highlight here that it's also, you know, My Health Record, there's another opportunity or another platform for you to view the discharge summary. And on the right-hand side, we've linked the relevant web pages where you can see which public and which private hospitals are connected to the My Health Record system and are uploading those discharge summaries to their patients' records. You will hopefully get a copy of these slides where you can click on these links and have a look. So again, with the pathology and diagnostic imaging overview, so again, as Peter mentioned, having this access to this information will reduce the duplication of tests and scans that we see happen a lot now in practice. Again, just consolidates all those reports for you. You're able to group them or sort them by the date or the test type. And then you're also able to click on the hyperlink to view the full report. And again, at the bottom of that slide is a link to our website where you can see a list of the providers that are uploading their reports and scans to the My Health Records. And that's also been divided by state, again, just to make it easier for you to locate that information. So here, an example of the Medicare information that you'll view in a person's record. So on the left-hand side is the Medicare Overview. So again, one of those overviews that was in the middle of the previous slide. The main areas in this view are the prescriptions that have been claimed, so PBS and RPBS claims. Then we have information from the Australian Immunisation Register, then the Australian Organ Donor Register, and then that Medicare services claim is what we've zoomed in on the right hand side. Again, for specialists, this particular view can be quite handy for you to have a look at which Medicare services have been claimed, who claimed them, so you can again get an idea of who's involved in that person's care and when they are next eligible for that service as well. So really exciting, again, functionality of the system is the ability to upload and to view specialist letters. So we have an example here of sort of a generic specialist letter, but now here we also have new software functionality that's enabled the specialist letters to be uploaded with the branding as well. So again, benefits here being saving time and money of having to fax or post these specialist letters, and it helps to improve continuity of care for patients. So that's an idea of all the information that you can find within the record. Now, if we just backtrack a bit now and address a common question we get asked is, can you access a patient's record? Do you need to ask their permission? So we get asked that a lot. Now, as I mentioned, there is legislation specific to My Health Record governing its use, and under that legislation, as long as you are an authorized healthcare provider, so your healthcare organization is registered and you've been authorized by that organization to access the record, and as long as you are providing care to that particular patient, then you do have the authority to view their record and upload information without their consent. But again, just as long as that episode of care you're involved. So whether it's at the point of care, right before or right after an episode of care, as long as that care is there. Now, there are instances where a person might restrict their access to their record, and those are the instances where you then would have to request access. And again, I will touch on that next, actually. So here on the screen, you can see the different controls a patient can have on their My Health record. So there are two codes that they can set on their My Health record. So one is a record access code, which restricts access to their whole record. And then another is an LDAC, or a limited document access code. And this limits access to certain documents within their record. So sort of like if you have a house, you can either lock the front door, no one can come in, or the front door can be open, but then the certain rooms within the household are closed. So in these instances, a message will come up on the screen prompting the access code. That's when the clinician would ask the patient for the access code. Once that's been given, it's at a healthcare provider organization level. So once it's been provided, the whole organization gets added to a access list, and then you won't need to ask for that code again next time. And also there are situations where in an emergency where these access codes can be bypassed, so I will touch on that next. But other controls a patient can have is choosing to receive an email or an SMS when their record has been accessed, and there is also an audit log that they are able to view when they access their My Health record, and this is the same for an organization as well. So the responsible person there, so maybe the practice manager in a lot of the cases, will have access to the audit log. So in an emergency situation, if any of these two criteria on the screen are fulfilled, then that would make it okay to use the emergency access function. So it's in the instance where a clinician believes that access to the record is necessary to lessen or prevent a serious threat to the life, health, and safety of the person, and they're unable to obtain their consent. So either that scenario, or in the scenario where it's access to the information is necessary to lessen or prevent a serious threat to public health or public safety. So again, the message will pop up on the screen with this information there for you to have a final confirmation that yes, one of these is fulfilled, and then the clinician will get 5-day access to the record. So any access codes will be bypassed. Of course, the only exception is any documents that have been removed from the system, of course, won't be there to view. But a very sort of common example of when not to use an emergency access function is in the instance where the person is there and they have forgotten their code, and if they still want you to access their record, that doesn't actually fulfill the criteria. So then it is up to them to log into their My Health record and reset their code. So just again to recap those benefits, so quick and easy access to information, reducing the administrative burden and that duplication of services. And again, it's just an additional tool that wasn't accessible previously, that again, it is up to the clinician whether or not they would like to use it. They certainly don't have to, but it's just there in the event that they need that extra information. Now, if we touch on a little bit about how to use it in practice, how it's used. So what we can see here on the left-hand side, providers are able to access My Health record through either hospital applications for those that are working in hospital, or there's the Conformance software. So again, there's a special process that the software needs to, or special requirements the software needs to fulfill before it can be deemed conformant and ready to connect. And then we have the National Provider Portal. So full functionality of the My Health record in terms of viewing and uploading is possible through the hospital applications and the Conformance software. The National Provider Portal is a view-only platform, but again, it's an ideal mode of access for those that don't have Conformance software just yet. And on the right-hand side, you can see the patients. Again, they have the option to upload through MyGov, as well as the option to view their My Health record through MyGov or through authorized apps that are available on the market. So we do have we have partnered up with specialist software vendors to help them sort of offer support and help for them to complete designs that are able to integrate with the My Health record system in their current clinical information systems. So what you can see on the screen there, these vendors are part of the industry offer to either introduce or improve My Health record integration. So we can see there is a fair bit there in general release at the moment. For those products that are listed in the design phase, where they're hoping to implement and have those products in general release within the next financial year. But again, so the benefits of having this sort of My Health record enabled practice software is just that, giving you that full functionality to view documents as well as to upload as well. So just sort of a recap of things to keep in mind when it comes to registering and using My Health record. First and foremost, before you even register for the system, there is a security and access policy that needs to be put in place. In this policy, you outline how you plan to access the system, and also you address the training that's going to be given to staff, and how you're going to keep track of whether once they're ready to connect to the system. And we have ongoing obligations in terms of, again, just to encourage appropriate use of the system. What I have here next as well is again, don't have time to address it too much today, but I have left you with a resource at the end. But these are the steps that the organizations will follow when it comes to registering for the system. So again, depending on which mode of access they choose, could be one, could be both, a few steps there. But we do have a specialist connection team that's ready to offer support. And I have left their number at the end with the other resources for you to get in touch. So what I'll do now is move on to electronic prescriptions. So again, some of you may already have had experience with electronic prescriptions, either personally or in practice. Again, just to give you a bit more information there. So in terms of the evolution of prescriptions, you can see on the screen sort of how far we've come. So we started off with the only form by which a medication could be supplied was a paper prescription that had to be signed by the prescriber. Then we moved on to the computer-generated prescriptions. And then in the third screenshot there, you could see this is when the electronic transfer of prescriptions model came into effect. So again, they were computer generated, but they had the addition of that barcode that allowed for the information to be shared, where previously there was still no way to share that information. And now we've come to electronic prescriptions, which essentially are paperless. So to touch more on the electronic prescriptions, so they're delivered in the form of a token, and then within this token, there's a unique QR code, and again, they still meet all the relevant legislation. A key thing to note is the token itself is not the legal prescription. The contents of the prescription actually are stored within the prescription delivery service. So we like to think of the token more or less like a key that will help unlock the details of the prescription from the prescription delivery service. So, and once that's scanned, that's the unlocking process where that information will be retrieved. And a key thing to know about the electronic prescriptions is they are optional. They will coexist with the paper prescriptions. And again, it's all about just having the supporting patient choice. So they can choose to have a combination of the two. As the only thing to note here is they can't have on the same day that a medication is prescribed, they can't have both for that medication on the same day, but they can certainly at the one visit have a paper prescription, then when it runs out and the next time they get it filled, they can choose to swap over to an electronic prescription. So what we can see here is that we've got more than 24 million electronic prescriptions that have been prescribed. So again, we've come a long way since its release in May last year. So on the screen there, you can see we've tracked the electronic prescriptions that have been issued by GPs, as well as the original and repeat tokens that have been dispensed by the pharmacies. Now, again, a common question we get here is when, what kind of medication can an electronic prescription be used for? And look, it's not all, but it's definitely the majority of medications. So on the screen, you can see PBS and non-PBS medications, the Regulation 24, the Schedule 8 medications, which has definitely been a game changer having that. So previously, these needed to be, in the prescriber's handwriting, so that's no longer the case. And also with authority prescriptions. So again, the majority, but there are some prescriptions where there is, for example, like the biological medications, where they need special approval, and the current practice is that they get sent by mail to Medicare to get stamped. That process will still be the same process for now, whereas the authority prescriptions where you can apply for that streamline through HPOS, you're able to prescribe that as an electronic prescription. So just to give you an idea of the workflow involved, so essentially the prescriber needs to prescribe the medication via the software, which is Conformance for electronic prescriptions. So again, we have on our website the Conformance register, so you can see which software is enabled for electronic prescription. And then once during the consultation, the prescriber will give the patient the option of how they would like to receive that particular prescription. And then it's encouraged just to check that the patient is aware that their pharmacy is enabled for electronic prescriptions. But again, the majority are, but again, just something to keep in mind. At that time, they will send the token. Now, it is recommended that they confirm then and there that the token has been received to make sure that it's the right details are stored in the system. And then after that, the patient can either present in person to the pharmacy with the token, or they can send that token via SMS or email to the pharmacy or to a carer who will then collect that medication on their behalf, or for example have the medication delivered by the pharmacy. Okay, so what you can see here is as an example of what the token would look like once it's been emailed to a person. So on the left there, you can see it will say tap here to view your prescription. You click on that hyperlink and then you receive the token to then scan. And then here we have an example of the SMS view. So we have two examples here just showing the from the two different prescription delivery services that are available. So slight differences in layout, but generally all the same. I'll just zoom in here. So key things to note here is that the token, so you can see the medication name there, the strength, the quantity. Now, if I've zoomed in enough, yes. So I'll just point to it here. Okay, so at the top here where it says electronic prescription for FB, so just something to note there that the patient's full name won't be visible there. It would just be their initials, and that's to help again, so security mechanism to help ensure safety and that it's not compromised if it was to get in the wrong hands. So the full name of the patient as well as the rest of the prescription will only be available once that's been scanned. And of course, so when the person presenting it, they would be familiar to the dispenser and then they would be scanning that, and that would download the rest of the prescription. So very limited information available on the token itself before it is scanned. Now here, just to show you a comparison of what the repeats look like for paper prescriptions and then for electronic prescriptions. So left-hand side, we're all familiar with, that's generally going to be on a yellow piece of PBS paper. And then on the right-hand side, the only difference really to note in the token is the number of supplies remaining. So everything else will look the same, and that's the only part that would be updated. So once a prescription is dispensed, if there are repeats, a new token is then issued to the patient for the next supply. So they won't be using that original token the 5 or 6 times, depending on the repeats. It would be a new token each time. Now what I'll sharing with you here is some common messages that appear in practice and the reason behind these messages. So in the first one there, where it says the prescription has already been expired. So again, just to highlight that the expiry for the electronic prescription is the same as that for a paper prescription. So in the event that all the supplies, the prescription has run out, again, there is no risk that the person will get extra supplies beyond the expiry date, as there is that functionality to alert the dispenser when they scan it that it has expired. In the next screen there, you have the message where it's already been dispensed. Now, as a pharmacist myself, I do see this message quite a lot in practice. Now, this happens when they've come to have the second or third supply of their medication, but they're showing the original token. So here is just an example of when they will need to present their most recent token. Now, again, there is the functionality within the software, again, for the dispenser to reissue that if needed or dispense off the most recent. And the last example there is when the message that will pop up in the instance where the prescriber has decided that the person no longer needs to be on this medication or they've changed it, they have the functionality to cease that from their end, and that will cancel the token if it hasn't been used, or if it's been used but there are supplies left, it would cancel the rest of the supplies. A key thing to note here is from the pharmacy end, if the pharmacy has dispensed that token, they've scanned it, and then if they've come to look for the medication and the medication is not on the shelf, then when they cancel it from their end, that just reactivates the token, whereas the cancellation from the prescriber end ceases the prescription. So just something to note there, the difference between those two. So with the tokens, so they're generally a very good solution for one-off tokens of someone who's just on a few medication. For someone who's on quite a number of medications, it can be quite considered quite difficult to keep track of all those tokens in their phone, especially when there's repeats involved. So there are management options that are available to help with that. So there are apps that they can help them store their tokens and help them keep track of it that way. We also have the active script list that has been rolling out now, and again, this removes the need for the person to hold on to their token, so it also overcomes the issues of any lost tokens. Having said that, if someone did lose a token, there is the option for the token to be reissued, but again, with the active script list, even that won't need to be done in that instance. Again, so just to recap the benefits for the electronic prescription. So as we've seen, gives greater choice for the patients while still maintaining their privacy and integrity of their health information. As we saw, happened with COVID, which was one of the reasons behind the accelerated rollout of the electronic prescriptions. It provided an opportunity for community members to, be able to stay safe and still have access to their medications. It integrated really well with telehealth services, so it was a very convenient mode of prescribing to supplement those telehealth services, and again make sure that the patient's care wasn't compromised. It was able to continue. In terms of improving efficiency for prescribing and dispensing of medications, it certainly helps to reduce errors as there is less transcription involved with the issuing and of the prescription and the supplying of the medication. And electronic prescriptions will continue to evolve, so there are constant software updates being done to help improve the compatibility, and again, so that just people are able to reap more of the benefits of the electronic prescriptions. So just some resources again for you to refer to if you'd like any extra information. So here's the email for the connections team at the agency, as well as the agency numbers helpline. If you have any questions you'd like about connecting to the system, you feel free to reach out to them. Also, we have virtual classroom sessions where you can see a demonstration, a live demonstration of how to use My Health Record. Now, currently, the software that we have a training environment for are those that you can see on the screen. So I'd imagine Genie tends to be quite a popular one among specialists. But again, we have the National Provider Portal demonstration there for anyone whose software may not be on the screen. If your software isn't on the screen, it's still worthwhile coming along to one of these, because although the layout might be slightly different at the start in terms of how to access the My Health Record, once you're in the My Health Record, it's generally all does look the same. Here again, we have free online training modules that are accredited. So we have for electronic prescriptions as well as for My Health Record. So again, these are available to anyone who would like to have a look there. And then we have the specialist toolkit here, the digital health toolkit, again, all things digital. So My Health Record, electronic prescriptions, telehealth, as well as secure messaging. You can find lots of information in there. If you'd like more information about the electronic prescriptions, so from the Department of Health, I've again just shared resources from their website. They have fact sheets for prescribers and for dispensers there as well, and a link to our podcast as well if you would like to have a look at those. But otherwise, that's everything from me. Again, just leaving you with the My Health Record helpline number. It's available 24 hours a day, 7 days a week. So lots of avenues there for support. But yeah, thank you very much. Happy to pass back now or address questions, see how we go.
Thanks, Emma. I might go back. Can you see my screen now, Charles?
Yep, we can see that.
Excellent. All righty. Well, thanks, Emma. That was great. I think there's a lot in there for specialist practices. A couple of things that I noticed, I think, was discharge summaries. I think often specialists miss out on discharge summaries. They often go back to GPs. So I think having access to discharge summaries through the My Health Record would be a real advantage. And also the e-prescribing. I think a lot of specialist practices are holding out for that. I know a lot of practices do use Genie. We believe we have a fairly good authority that Genie can actually release e-prescribing in their next update sometime in December. So that's something that might be worth, well, hopefully will come through fairly shortly. I might just cover a couple of other digital health initiatives that are available at the moment, and a lot of them tie together in, as part of a package. But e-requesting is something you may have heard of, and that's really just e-requesting for pathology and diagnostic imaging. Still at the moment, you've still got to actually use the paper-based forms as well. But what it does is it sends from your clinical software to the receiving service, gives them all the information. There's less chance of clinical errors, less chance of transposition errors or input of data. So it actually, again, just makes a safer system all round. And if you're looking to go further with e-requesting, just a matter of talking to your software providers, your clinical software providers, and also the different labs that you might use, and they can help you get that sorted out as well. It is important to remember with diagnostic imaging and pathology, those results, where you are e-requesting, it does also mean that some of them can go up to the My Health record. A lot of people do worry that when they go up to the record, that the patients are going to be able to see them before the specialist or the doctor has had a chance to review them. That's not the case. They do actually, there is a 7-day delay between when they actually go up to the My Health record for the patient to be able to view them. So you've got plenty of time to be actually able to actually look at that record, look at that result and contact the patient beforehand if need be. There is an exception to that, and that is some of the COVID-19 pathology reports where they go straight through. One of the other digital health initiatives, and something that we as a PHN are very closely involved with, is e-referrals. Now at the moment, these e-referrals don't go up to the My Health record. This is purely a Hunter New England initiative across the Hunter New England LHD. It's a joint project with the Primary Health Network, Hunter New England LHD, and Health Pathways, and BPAC as the clinical software providers. And what it is, it's a secure e-referral system that is it's a two-way solution, if you like. It's designed to have GPs refer into the local health district, but also private specialists can be involved by consent. And we've got about 90% of practices across the Hunter New England area at the moment. If we've got any Central Coast people watching, unfortunately, we haven't rolled the product out down there at the moment. That is something that we're looking at, but it's certainly right across the whole Hunter New England footprint. And as I mentioned, 90% of general practices across the footprint have got capacity to use the software. And to date, we've had something like about just under 70,000 referrals go through the system. So it's a widely used system. If any of this private specialist practices would like to get involved with that, just a matter of contacting me. My contact details are there. More than happy to talk through what's involved and to get you moving in that direction if that's something you'd like to look at. One other thing that's coming up in the digital health space, and you've possibly been getting communication again out from clinical software providers and the agency if you subscribe to their email service, is around the NASH certificate and changes to that. The NASH is important. It really underpins all of the different digital health initiatives at the moment. Secure messaging, electronic prescribing, healthcare identifiers, and My Health record, they all are underpinned by the NASH certificate. It really is the key to everything, as it's got it there in the diagram. NASH certificates are all expiring between now and March next year. So if you've got a NASH at the moment, you need to be looking at how am I going to transition that? And I won't get too heavily again into the detail, but they are moving to a higher level of encryption or safety. So if you've got a current certificate, you may need to be looking at increasing that one, going from a SHA-1 certificate to a SHA-2 certificate, but you've got until March next year to get that sorted out. And it's also, before you make the move, make sure that your clinical software is actually up to that current version to allow you to do that. Proda HPOS, again, if you're looking to get yourself set up and get organised for your practice, Proda is the online vehicle where you do all of that. Proda and HPOS, Health Professionals Online Service. It's important with Proda and HPOS to make sure that you've got the right setups. One of the other things that's changing in March next year, your PKI certificate or your site certificate is known. They're actually going to become defunct after March next year. So you'll have to update and get set up for web services because that's how your Medicare claiming will be done. So if you haven't made that change in time for next year, you'll actually be unable to do your Medicare claiming after about, I think it's the 16th of March. So that's something that you need to look at now, and it's an organisational Proda account as well as individual accounts to make sure that you've got the right people in the right positions so that you can actually get that to function correctly as it is. But again, if you need any assistance with that, we can help you with that as well. And there's a lot of information on the Services Australia website as well. And I think we're going to provide some links to that information as well at the end of the session. And just some contact details there. So and again, all of this will come out, so you don't need to jot these down. We'll provide copies of the slides at the end of the session. And I think that's it from me. We might go to questions.
Thank you, Peter. Wonderful. All right, we do have a few questions that have come through, so I might invite all of our panelists to pop your camera and microphones on. Thank you so much to Jolene in the background, who's also been typing responses. And because we've got the time, we might also just jump to see if there's any other comments that the other speakers might like to add to these. So thank you so much, Catherine, for all of your questions. And of course, anyone else, if you have any questions, please type them in now and I'll read them out for our speakers. So Catherine's first question is, I don't yet understand how the hospital can access, and I think this is to do with my health record and discharge summaries. Samar, is that a question for you?
Yes, so Catherine, with use in the hospital, the best person to for you to find out about how to access will be the health information manager in the hospital. So they would typically be the people that were involved in the registration and are familiar with how. But in terms of some hospital applications that are in use, so we have there is, for example, a HIPS viewer that some applications use, but again, it's going to differ across the different hospitals. So if you wanted to pop in which state you're from, I can follow up for you from there, but otherwise your health information manager will be the best person to contact. But let me know which state, and I can let you know what's the program there, and then that might ring a bell for you.
Yep, so Catherine is from New South Wales in our Hunter, New England region.
Oh, okay, yes, beautiful. Then yeah, they should be using the HIPS viewer there. So if you're not able to get any information from them, again, just send us an email. So that will be on the slides that you'll receive after, and I can follow up for you.
Great, thanks, Samar. Thanks, Catherine. The next question is there a standalone conformance software for e-prescriptions?
Yes, I can talk to that one. So for electronic prescriptions, so essentially, so there is that conformance process. If you mean standalone, like if you're referring to My Health Record, you don't need to have My Health Record to have electronic prescriptions, if that's what you mean. But again, for a list of which software have undergone that conformance process, that will be shared with you afterwards. But yeah, I think that's what you meant from standalone, in that it's separate to My Health Record. You don't have to have one to have the other.
I'll just jump in now. And the question was, I think there is, with My Health Record, you do have the provider portal. It's a sort of a standalone. You don't need a conformant clinical software. For e-prescribing, you do need to have a conformant clinical software package. So there's no standalone product outside of the clinical software that you would have for your practice.
Ah, yes, yeah. Yes, that's right. Yes, it feels like, yep.
Yep, thanks, Peter. Yep, that's what Catherine was just saying in regards to e-prescriptions. Yeah. And I think you sort of touched on that. Catherine's saying that she doesn't have a commercial clinical information system. So you're saying, Peter, that she would need to, okay.
You would need to actually purchase one of the commercially available clinical systems, yep.
Okay, so if Catherine wanted some advice around that, who's best to contact?
We could have a talk with her about that, but we wouldn't be able to make a recommendation.
Okay. All right, I think that's all the questions we've answered, Catherine. Feel free to type in again. Thanks for typing in and letting us know that we're answering your questions. We haven't got any other questions from anyone else online as of yet, but we still have a little bit of time, so please type your questions in now if there's anything burning. But as mentioned, the slides will become available. I'll put these up with the recording on our website tomorrow, so you'll be able to access all this information and the links that are contained within the slides, and obviously the relevant contact details. While we're waiting for any last questions, is there any other final comments from our speakers that you'd like to make, or any key messages that you'd like our attendees to take away from today? If they take away one thing, what is it?
Well, I can say, like, as a a practicing pharmacist, still, I'm still doing the shifts on the weekend, I can definitely see the, and it's great for me to be in that position just to see the positive outcomes we have from having access to these tools. So, when I have someone come in, I've never seen them before, they're stressed, they can't recall their medication or they're out of it. It gives me confidence, it gives them reassurance. It's definitely a win-win for both. With electronic prescriptions, I can see myself personally, I manage my parents' medications. It's made things so much easier for me. So again, I think we're all very fortunate that we have these tools at our disposal. So yeah, we just encourage everyone to make use of it.
Wonderful,
yeah,
thank
I think
you.
I'd second that. I think I'd second that. I think there's a lot of, it may seem initially confusing when people start to hear the digital health technologies, PRODA, HPOS and things like that. But I think if they just step their way through it, I think they'll get there. And I think, there's assistance available. And I think, consumer demand, patient demand is certainly pushing that way, that they want to adopt the digital health technologies. And e-prescribing is a great example of that.
Absolutely.
Okay, great, thank you. So we haven't had any other questions come through the chat, so we might leave it there then. And I just want to take this opportunity to say a big thank you to Seema Omar from the Australian Digital Health Agency for generously giving your time this evening to not only prepare information but present. And of course, thank you to Jolene and Peter for all your help in organising the session and preparing your content and being with us tonight. As I've mentioned, it is being recorded. So if you do have colleagues that are interested and may have missed it this evening, they can definitely catch up and watch this recording in our education library, and that should become available from tomorrow. As mentioned, there is also a short evaluation survey, and that'll automatically pop up when I end the webinar in a moment. If you could just take literally 1 minute to fill that out, we'd really appreciate your feedback. We're always looking at ways that we can improve our education delivery and take that on in terms of future topics that you might be interested in as well. That's all from me. Thanks again, everyone.
Thank you for attending.
Yeah, thank you. And we hope to see you at our next event. So have a great evening.
Thanks, Charles.
Thank you. Good night.
Good night.